So a big thank you, everyone, for joining us today, particularly for, I think, those 11 or 17 people who were on in those first few minutes and bared with us as my internet was totally down and I had to get that back up actually on a mobile hotspot. So hopefully that doesn't happen again. But if it does, we have Jonathan Klein here, our Director of Risk Management and Safety Education. He's going to be taking over in case that does happen. So that way we have a seamless experience. And today we're going to be talking about health and safety after the vaccine. So the thought here is that in the future, we are slowly approaching, in some cases, accelerating towards more of a vaccinated populace. It's great to see. I actually got my first shot the other day, which was a welcome relief. And as that's happening, there will be changes that we can possibly anticipate. And when you're able to prepare for those changes, it really puts you in a position for success and to kind of start preparing today for how the future might look, in a couple of months here. So without any further ado, I'll go ahead and kick it over to our two panelists, Mary Louco and Craig Merlick. And if you wouldn't mind going through and introducing yourselves, Mary, would you like to start?
Sure, that's great. Thanks, Matt. So my name is Mary Louco, and I have been in the field of health and safety for, I guess, over 20 years now. I have a background in biology and chemistry and a master's in occupational health and occupational safety, focusing on industrial hygiene. And I've worked in the R&D world most of the time, specifically around pharmaceuticals and chemical industry. And in the last 9 months, took on a new position within the company as the global occupational hygiene expert for our company, which is an interesting challenge when it's international and over 100,000 people. So it keeps me busy.
And my name is Craig Merlick, and I'd like to welcome everyone here today. I'm a professor of chemistry in the UCLA Department of Chemistry and Biochemistry, and I've been there for more than 3 decades. And I'm also the executive director of the UC Center for Laboratory Safety. So a lot of my work focuses on research safety in the universities, not only at UCLA and not only the UC system, but actually nationwide. So we have a lot of projects going to promote research safety. And then back to the UCLA campus, I'm involved in a number of safety committees, but in particular campus-wide safety committees. And then most recently, COVID-19 based committees. So research continuity, teaching recovery, ramp up for research, and a number of activities related to COVID-19. So that's some of my background.
All right, fantastic. So I'm very excited to explore this topic with both of you and kind of see what comes out of the woodwork. One of the things that we would love to see is having you, our attendees, kind of go into the Q&A and let us know what's on your mind. What are the things you're thinking about or worried about? Have you uncovered anything where you were surprised and realized, wow, this is actually something that I really want to think about? I think now in this next hour, we're really hoping to uncover some valuable unknown unknowns to help everybody be a little bit more prepared as things start to change. So to kick things off, a question for both of you. Do you think that any fundamental priorities for health and safety have appeared or lost importance and over the course of COVID, and also as that will change in the future? Mary, if you'd like to start.
Sure. So I think one of the things that I think about over the last year, I guess, that became more important was the overall role of health and safety at our organizations. I think we've really been able to have a larger seat at the table within leadership to be able to show what our skills and expertise can bring to the table during times like these, where we really have to lean into the science, learn about things that are rapidly happening and occurring as ongoing, and not all the answers are available right away. So, I really see that as something that we can keep the momentum going. I know from colleagues and others, sometimes it's really hard to be able to have a strong voice sometimes. If you have a good program, it's going smoothly, but I think this was a really nice opportunity to make sure that people understood we have a really great background in biosafety, laboratory safety. There's things we can help to ensure control and limiting any potential exposures in our workplaces. So I really see that continuing to be able to be seen as a real value in our institutions going forward.
And I would definitely agree with some of the comments that Mary said, that our EH&S has really shifted their focus. And it's interesting for me, since I'm a chemistry professor, that the title of EH&S is environmental health and safety. So health is one of the key words for the occupation. But what I've seen is that on campus and other universities as well, EH&S, they have a much more greater focus on health than research safety at this time. And they were able to make that pivot on a dime and have a much greater importance on that. So I know that on our campus, the number 2 person within the structure of EH&S, her job actually changed. And so she's now, a key lead. She actually is the leader of the emergency operation team. And then she actually negotiates with the campus legal counsel with the Los Angeles County Department of Public Health. So the university is negotiating how we can do certain activities and when we can ramp up. And literally it's the number 2 person at EH&S who's negotiating with the county health director. So that's a very interesting pivot from her prior activities. And I also agree that this is going to be going on for a while. So certainly it's going to take a while before we're through with the pandemic based on the ramp up of vaccinations. But actually, I think it's going to be a role that's going to be continuing on for EH&S for a while. So, I think there's going to be concern about variants. And so I don't expect the EH&S role in COVID-19 is going to end in the next 6 months or 12 months. I think it could potentially be a much longer endeavor. So whereas our EH&S has focused a lot on research safety over the years, I think they're going to have this public health safety component as a significant ongoing mandate for EH&S office.
Yeah, I see this pandemic as having 2 very long tails. On one hand, just a long tail on how COVID cases disappear, how the spread of coronavirus stops and slows down. And then also, I think that there's an important psychological tale too, just the impacts of having lived through this time and what that will do to us psychologically, how we think about risk, how we think about health and breath and air, and also how we think about the people who kept us safe during this time and who set policies and worked with us. This is an opportunity for health and safety to gain a huge amount of credibility that can hopefully, last them for a long time into the future as people think about they remember this time, they think about what went on and what went well and what gave them support and what, made things worse. And if health and safety can be in that positive category, that can really make future conversations, getting seats at the table, getting input a lot easier. Craig, you mentioned having contact with that number 2 to really get important information, right to the source.
Yep. And just another example is infrastructure. So on UCLA campus, we have about 100 buildings, and since the lifetime of any one building is about 25 years, that means we're doing 4 major projects at every single time, at least. And so for ventilation, it's been a big issue. And I think moving forward, the design standards are changing based on having increased ventilation rates. And so we're now having, right now, we're having meetings between EH&S and capital programs to set new building standards for ventilation. And we're looking at, accelerating the replacement of some of our buildings that have very antiquated ventilation systems.
Yeah, I completely agree. And just seeing that someone had mentioned that in the chat also, I think this is going to be a time where we really have to work together as integrated teams with engineering and facilities and others to really figure out how do we manage our initiatives for the environmental sustainability, and how do we still maintain a building environment that has the protections that we need. So I think it's not an easy road ahead, but I think it's perfect because we're looking at new ways of building and managing buildings anyways. So it gives us some opportunity, as Craig said, to kind of work together and say, all right, what do we have to have in place? And maybe it's just options that are still available that you don't have to use at all times. So I think people have to come up with unique solutions going forward.
Mm-hmm. And have you seen a similar push in lab design as well? I know for those who aren't aware, we had Mary on our laboratory ventilation best practices webinar. Is that correct?
I think so, yeah.
Okay.
I know it's around ventilation. I forget the name, but yeah.
Yeah, so Mary is very knowledgeable in this field as well. And just great to have the perspective here.
Yeah, I think one of my main areas that we really are trying to focus on now too is, as we have to renovate buildings and put in new buildings in places, the real trend in the industry is to be very open laboratory space, being very agile to be able to create and change who's using the laboratory space as needed, and really having shared equipment rooms or shared areas so that not every department needs their own HPLC machines, maybe, for instance. So how do we manage that? How do we manage that potential risk and have a way of really saying, if a department doesn't own a piece of equipment, but we know that it needs to be cleaned and decon between use for many reasons, not just for health and safety reasons, how do we ensure that there is a structure in place for accountability and to know that it's actually being achieved? So it's one of those areas where it's really good, especially from the environment, to be able to share more, but then how do we do it in a safe way?
I think the challenges posed by open spaces are significant. At the university level too, there's been interest in having more open labs, and that potentially allows you to change utilization of space, have more sharing, but also in terms of COVID-19, it presents challenges. So if you go from a lab that is designed for 4 people to a lab that's designed for 14 people or 24 people, then all of a sudden you have much greater numbers of people in contact. And so it creates more challenges for COVID-19 safety practices to keep the distancing, keep the density of people low. And so it creates those types of challenges specific to the pandemic. But we've also seen on the university campus challenges for EH&S in that you no longer have a lab with a small set of hazards. Now, as it becomes more collaborative and interdisciplinary, then all of a sudden the number of hazards in one more open lab, it grows significantly. And so that creates more challenges for EH&S to set the safety practices in those labs. So there's challenges both for research safety and COVID safety when we have these open labs.
Yeah, Mary, I liked what you said earlier about disinfecting shared spaces, and how do you manage that shared equipment where you have something very specialized or expensive that often might require a dedicated technician to work, like a fax core, for example, where normally, your fax setup is not going to be in a large, open, airy space with a lot of airflow and everything, or like, laser things. It just making sure that people are really thinking about that going forward as you're designing new spaces, considering policies, putting in places, remembering that, there's now like an entire new dimension of planning and logistics that need to go into health and safety to try and design spaces that are flexible to accommodate risks from COVID. And, reminding everybody of that just might, again, help to get you in at that early stage where your input can just save you a ton of time, especially from the design element. I know I've talked with so many people. We spoke about this a lot on our laboratory ventilation webinars, how if you could just get in at that design point, make a comment about airflow or design, that can just save so much headache and cost down the line. And, Craig, to your point about laboratories opening up and becoming just larger, there's also a side question too of, right, if a space has to close down, how do you handle flexibility? If you need to shuffle groups around, knowing where your spaces are, what you have available. Just wondering, is that something that is on your mind as well? Thinking about, okay, if we're designing a new space, can we have the flexibility to keep operations going if we need to, shut down space for a while for any reason, without having it like tank an entire lab's productivity?
Yeah, the university tends to move a little slower than industry,
Yeah.
And renovation costs are significant for us. So if we have a lab space, it's unlikely that we can do a significant change in response to something like COVID in a timely manner. So we do need to plan with a longer view in mind. So it's we have to, set our parameters and then choose the space, and then we tend to live with that.
Mm-hmm. And I would say, Matt, too, we of course want to be there during the design and be able to have a voice to say, okay, here are some of the best practices we can do. The other thing I would say, if there are already existing buildings, is really to ask those very specific questions and to learn the most you can on how your system really works. Because a lot of us sometimes, as they say, have some assumptions of how it's working. And then when we really sit down with people and ask them, how does our night setback work for, green energy reasons or something? Or, how do we do our maintenance of the system? How often do we actually do verification that the system is running as intended from design? You may be very surprised at the answers you receive. So I would say if there's opportunity, this year to really kind of sit down and really learn your buildings, because I think, of course, we've learned a lot during this pandemic on the fly. But one thing I learned was when you don't know those questions and then someone asks you those questions at, say, 11 p.m. at night for the next day, it's really hard to answer. But if you have some of that already available to you, it can be much easier, kind of in the future.
Great. Well, kind of moving on. Oh, sorry, Craig, did you have something you wanted to add there?
I was just looking at the Q&A questions, and I'm not sure how you wanted to prioritize, when we do which one. They're all good questions. I was looking at the one posted by Sarah Morris.
Yeah. Normally we put our Q&A sort of towards the end to segment the two, but we can also try for a more integrated Q&A. If you see something there that you think is really relevant and you'd like to address now, we can definitely go for that. One thing that I will caution you about, it's an unfortunate feature of Zoom webinar, is that if you, as our panelists, type a response to a question, it will kick it from the open tab over into the answer tab. So that can make it a little more difficult for me to track, what we'd like to discuss. So if you see a question you'd like to answer, I'd recommend clicking on the answer live button, and that way we can talk about it that way. But yeah, Craig, did you want to get to that question by Sarah before we move on?
Yeah, so like when we talked about this webinar, one of the things we talked about was what are our most pressing concerns?
I'm gonna jump in first. Here, just to read the question out for everybody who's not on here. For the recording, they're not able to actually see the question there. Okay. So the question from Sarah is, do you have, oh gosh, it's jumping around everywhere. Thanks to everybody who's thumbs upping these. It's actually very helpful. Do you have any advice on how to have the conversations about bringing our occupancies closer to pre-pandemic levels, considering vaccinated and non-vaccinated persons will have differing levels of risk tolerance?
Right, so that's an excellent question. And it's actually one of the main ones that's on my mind. And I was thinking about that before this webinar. UCLA and a lot of institutions in California have had very serious lockdowns and reductions in personnel densities. And so getting the campus back to pre-pandemic levels is very high on our minds right now. And in particular, we're looking at vaccinations and how that will impact it. So we don't want to necessarily wait for the state to, at some point, 6 months from now, a year from now, say, oh, everything's fine. We want to try and use the best science to try and bring back the research activities on campus in a safe manner. So it was very exciting this week on Monday when the CDC released guidance for interactions for vaccinated people. So the CDC put out recommendations that for fully vaccinated people, they can do the following things. So that included having groups of fully vaccinated people meet together indoors. So that's an excellent change. But in the context of research, then it becomes challenging because you have maybe groups of 5 or 10 or 20 or 30. And so does the CDC guidance relate to all those different sizes of groups? And also the CDC guidance was ideally directed towards, say, family units or close related groups. But if you have 10 researchers coming from 10 different family units, then the potential exposure is quite large. So how do we address that? And then 10 out of 10 vaccinated is awesome. And so I'm having a meeting this afternoon where we're going to try and come up with recommendations for opening up based on that. But that's also optimistic. So what do you do when you have 9 out of 10 or 8 out of 10? So we're meeting with epidemiologists and infectious disease experts to try and come up with recommendations. And the feeling of them is that right now, obviously, if 10 out of 10 people are vaccinated, researchers can to work in a closed space. But even 9 out of 10 and possibly even 8 out of 10 is okay, given that they're not at risk for serious consequences of COVID. So we're going to be creating guidelines that say something to that effect, that you can have one person who's not vaccinated so long as they're not at risk, and also so long as they don't have family members at home who are at risk for serious consequences of COVID-19. So these are some of the parameters we're looking at. The CDC also recommended that you don't have to have masking indoors for this group of vaccinated people, but we're looking at mitigation measures based on safety, that if you have, say, only 9 out of 10 vaccinated or 8 out of 10 vaccinated, then they could still meet in the research space, but they should be wearing masks to increase protection. But then also for research group meetings, you know, that's one of the great things about science is when we get in a room and talk about science and chemistry and physics and have ideas, and Zoom just doesn't cut it for that. But I think for the foreseeable future, we're still going to be recommending that group meetings, especially if it's more than 10, that they remain online. And then, but for many research groups, they have, they might have 12 people in the research group, but they're split amongst maybe 3-4 person labs. So that's going to be beneficial to have these smaller lab rooms such that we can keep the lower, you know, have everyone come back, but they're not necessarily interacting. And so if you have, say, 2 out of 12 that are not vaccinated. Mm-hmm. So those are some of the considerations we're looking at, but I'm sure Mary has ideas there too.
Yeah, so I think that's really interesting to hear the things you're working towards, because it's really hard not having scientific people do the jobs in the laboratory, right? That's what we love and want to do. So it's hard not to be there. I'd say from our perspective, we really have a whole team that work together on these questions around HR, legal, everything, medical surveillance, our occupational doctors. Because the biggest thing about the vaccination question is you really can't ask people due to privacy issues. And you can't highlight people based on their vaccination status. Or so we're kind of looking at, you know, from what we see from the information available out there right now. So, you know, a lot of people, I think, initially thought, oh, we could have like a different type of badge and we would know people that are vaccinated or not within the workplace. But really that's not something that can be done. But so what we're trying to tell people is, you know, this isn't a flip the switch and now we're good once we have a certain, you know, level of vaccinations in the area. But it has to be, you know, really a systematic approach of increasing our population at the sites, utilizing our same controls that we've had. Like, I don't foresee our controls of trying to social distance as much as possible, wearing, you know, masks and protection going away anytime soon, because we want everyone that needs to be on site to be able to come on site in a safe manner. So it definitely is not an easy discussion or an easy way to figure out what to do. And, you know, each institution has their different things they have to work through. But so I think we just have to remind people to remain patient. How we've done it is we have groups of like A, B, C, and D, and you know what type of group you're in based on, you know, your need to be at the site, based on your job task, or because you would like to from your kind of, you know, mental health, and, you know, that you would like to actually work in an office environment. Some people really thrive more there than at home for many different reasons. So we are making sure that people can be in the group they feel most comfortable in, and we'll update people on how they can then go back to those spaces based on their group that they're in. So trying to do it kind of by the risk and in their openness to going back. We don't want to force anyone back before they want to either.
Yeah.
Mary mentioned that there's also a lot of Q&A questions about whether you can ask people if they're vaccinated and privacy issues, HIPAA, etc. Those are all very important questions. And so your institutions need to meet with the legal counsel to try and go through that. But we meet with our legal counsel at UCLA on a regular basis, and they're coming up with ways of phrasing it such that, you know, we can make going back to work in a certain way a requirement is having vaccination. So then people would have to be vaccinated or show proof of vaccination, or have some accommodation if they're not vaccinated. So we are working on that, and I think every institution will have to work through their legal counsel to get clean advice that's applicable to your institution within your state.
Mm-hmm.
And then just to kind of build off of that, you know, what everybody said so far, in terms of navigating these conversations, I think that one of the things we have seen, unfortunately, time and time again, is that when we overstep with COVID, when we go too fast, when we assume that things are better, when we take risks, the punishment from that is just so drawn out. You know, these peaks have so much inertia in the reporting that we see, the spread, the fallout, that all takes so long to come up. And then once you start seeing it, by then again, you're that 2-week lag period. It takes a very long time for things to fade back down. So just maybe encouraging a mindset of more of a conservative approach and trying to keep the risks of kind of overstepping in mind might help to, again, get everybody aligned onto the same perspective so you can reach goals more easily.
I think you're absolutely correct. There's been a lot of discussion with our EHS on to have a controlled ramp up. Many of the researchers are chomping at the bit to get back in lab full time, and they really want to have their grad students and staff and postdoctoral scholars, you know, back in the lab full time, having everyone interacting. And so our H&S is a small team, and then we have 850 different research groups led by faculty. And so, to have 8 H&S laboratory inspectors trying to manage the 850 research groups, it's quite a challenge. And so among the 850 groups, there are certainly those that are taking a very measured response, wanting to, you know, strictly abide by the best available science on vaccinations before going back. But there's a lot of groups that are really wanting just to get their students, researchers back. So the mandate to H&S then is to have a science-based policy procedure for ramping up, and work with the research faculty to make a plan so that it's acceptable to everyone, to then have better buy-in as we plan a ramp up.
Great. So moving on here, just to keep things going, we've been having some really great conversations so far, and I absolutely appreciate all of this engagement going on in the Q&A. Looking forward to seeing more of your questions as we go. Mary, the question that I had for you was, how have you integrated lessons learned from COVID-19 into the crisis management program to be better prepared for the future?
Yeah, it's a good question. So I think as we look back at the things that went really well at the beginning of you know, the emergency response and crisis of the COVID-19, and what things we maybe struggled with, or it took us more time to figure out, and what we can do going forward. So for me, when I think about it, one of the things that we needed to do was, and something we can continue to work on, is really thinking about true scenarios and working through those scenarios and have them be part of your plan, because you know, it can really help you to know the key things we need to focus on first. If you really think about, okay, you know, every crisis is always different. So even though some of us went through and did a lot of this during the avian flu in 2008, and we kind of knew what we were doing there, most of that stuff was out the window for what we needed to go do for COVID. But it's still good to kind of go through and have different types of scenarios you work through with your leadership team and your teams on site, so they're aware. I think the other thing we learned was, as I said before, is really knowing your buildings and systems before a crisis happens. So a lot of times we might have some drawings, some, as-built from when it was built 20 years ago, maybe no updates after that. And it can be really challenging. So I'd say trying to find a way to implement checking on if you have the most relevant information available to you every so often, even if it's just once a year, you go through and ask the different teams, do you have current information is good. And we really relied heavily on our purchasing partners, making sure that we could still maintain our PPE we needed from a laboratory safety standpoint, knowing that there was going to be shortages and supplied, stops from all of our different manufacturers, especially quite a few coming from Asia. So we really had to partner with them quickly and partner for them for what we needed to do for COVID-19 for our critical employees that had to continue coming to the sites. So they were big, big partners, and they learned a lot about what are masks, what are respirators, what are face coverings. So that was a big thing. And so you can't always take everything from each scenario, but I think just really looking at those plans more regularly can be very helpful. The last thing I would say is we also learned when you have very limited people on your sites to try to reduce, interaction of people, how do you also maintain your your emergency response teams? Because we still have to ensure that people can get the assistance they need if there was an emergency. And that was really challenging at first to figure out how to manage that perspective.
Mary mentioned PPE and being able to purchase the necessary PPE, and at UCLA that changed quite a bit. Before COVID, each research group ordered their own materials. So I, as a professor, would order gloves for my research group. But then the pandemic made it difficult to get certain PPE. So UCLA ended up centralizing purchasing and try to provide a better resource to all the research groups. So that way, rather than 850 different groups trying to order and find PPE, there was one central committee at UCLA that took that over, and then we're able to supply it to the campus.
Yeah, I've seen this a lot in my own research into these groups. I've talked about them before, called high reliability organizations. They are groups like aircraft carriers, submarines, nuclear plants that just cannot fail and have independently developed very similar ways of operating. And a big part of that is that you can't prepare necessarily for a crisis, but you can, Mary, like you mentioned, be prepared to be prepared, right? Or prepare to be prepared. A lot of what they would do is focus on flexibility. So, like Mary, you mentioned again, knowing that you can answer those questions when they come up, because the reality is we don't know what questions we'll need to answer. In this case for COVID, the issue was we needed a ton of N95s and respirators and hand sanitizer and all these things that suddenly you needed to source. So if you take that lesson and say, great, next time we're going to have our hand sanitizer and respirators pipelines lined up, so the next crisis, we're good. You are going to be in a lot of trouble when, the crisis hits, and those are totally unimportant. But Craig, like you mentioned, going instead to say, okay, so the issue we encountered here was at its root cause, we were not able to centralize and mobilize on PPE procurement fast enough and at the scale we needed. So let's see what we can do to have that, because definitely PPE will be needed. And then maybe look around and say, okay, where are some other areas where we're slow moving, where we might need to be fast moving again and responsive? And possibly we found in a lot of cases, particularly centralized procurement gives you a lot more leveraging and buying power to acquire some of these supplies that may be difficult to get in more fragmented ways.
Yeah. And that's all good thinking, but the challenge is always time and money, but time over time. So for example, many states had plans for respirators for use in hospitals. But then when 20 years go by where there's no need for this huge bank of respirators, and there's budget woes along the way, then people start chipping away at the resources provided to those emergency supplies. And so, we can hope that in 30 years that this pandemic is gone, but then are people going to forget the lessons we have learned from this? And are people going to say, well, it's costing me $1 million a year to keep this warehouse open and stocked with equipment to keep it good and not let it go bad. And there's going to be pressures over that time and on that money.
Yeah, I think that's the hard part too, because you can build in a lot of redundancy into your system on those really key items, but all of that comes with a big budget number. And to your point, Craig, it can kind of get that creep of getting dwindled down over time. But I think having people understand the philosophy behind being able to have some of those, and then they have to make a risk decision for their company. And ultimately that decision might change over time, but it's a good process to go through at least.
And I think EH&S should be involved in evaluating those stores of materials to make sure it's updated. I was involved at UCLA in a funny exercise a number of years ago where we had cans from the 1950s of emergency food as part of the nuclear fallout shelter. And I actually saved some of the cans as historic relics.
Great. So just before we move along here to our next session, I would just want to give a quick plug for our upcoming webinars here. So in 1 week, we are going to have our third drop-in problem solving session. So these are sessions that Jonathan Klein and myself put together, kind of like an EHS call-in show, like Car Talk, but for health and safety, just trying to help people come together and create a space where you can talk about the challenges you're facing and hopefully walk away with a few solutions. Then in 2 weeks, we are going to be talking about designing safety training that sticks when your safety training has to combat with COVID for mental real estate. After that, talking about how to engage your scientists in safety, really building that grassroots safety movement at a time when everybody is maybe more invested in their health and safety than they have been before. And then finally, our newest webinar is going to be talking about breaking down internal barriers to safety. So how do you navigate internal politics and all the things that might stop you from moving something forward and really align and get buy-in on safety. So that way you can focus on the difficult task of keeping people safe and not trying to convince people that it's important in the first place. And then, as I mentioned earlier, we have our prompt of the week here, asking about webinar topics you'd like to see. So great to see people contributing here. Really appreciate everybody dropping in and letting us know what you're interested in. So go ahead and continue to put those in. It's great to see them, and we'll be checking back on that later. All right. So Craig, the next question that I had for you was wondering about how you, or like what you did to get your professors engaged in lab safety. And then in addition to that, maybe expanding that to just general scientific personnel who are associated with that.
Okay. So one of the challenges that the universities face is having the professors focus on lab safety, given that they have so many other things to focus on. One description of research professors is that they're like a small company. So they have to come up with ideas, they have to hire staff in terms of students and postdocs to do the research, they have to be fundraisers in terms of grant funding to get the money to support the research, then they are their own publicists in terms of publishing the research, and we don't have a lot of support. And so sometimes research safety gets pushed to the side. And as we think about ramping up from the lockdowns on COVID-19, we want to make sure that faculty do that in a responsible manner and have a good focus on research safety. So the question is, what can EH&S do to try and engage faculty to make sure they're thinking about safety as they ramp up, and then have it be an ongoing activity for faculty beyond the rush to ramp up. So one of the things that we do is we try to embed EH&S staff in various departments. So rather than only having a centralized EH&S office and then they come out and visit the campus, we have a couple departments where there's EH&S staff actually located in the building. Another thing we try to do is have EH&S be involved in presentations to the faculty. So if we're having faculty meetings, department meetings, then we try to invite EH&S in, not only to convey information, but to establish that personal connection, because the personal connection can go a long ways in promoting safety. So that if I'm thinking about doing a new type of experiment, if I know that Susan in EH&S has a particular expertise or knowledge in that area, then I can draw on her for that expertise. Another thing we do, or we have a very active chemical and physical safety committee on campus. And so it turns out that the federal government mandates certain campus committees. So there's an institutional biosafety committee, radiation safety committee, a few others related to that, mandated by the federal government actually. But when it comes to chemical safety and physical processes safety, there's actually no mandate. So some universities might have a generic safety committee for the campus, but oftentimes they're too focused on sidewalk safety and lighting and things like that. So it's important for universities to have a chemical safety committee that's on a par with their research safety committee and the institutional biosafety committee. And then that committee works as a committee of faculty to set policies and regulations that guide the campus. And they work with the EH&S on that committee so that way EH&S has buy-in for whatever regulations and policies are set for the campus. And as one example, the federal government requires that every organization like this have a chemical hygiene plan and a chemical safety officer. So those are required items. And so some schools have those sort of completely managed by EH&S. But what we do is we actually integrate it with the faculty committee. And so the annual review of the chemical hygiene plan is done one-on-one with a group of faculty and EH&S. So that's why there's the faculty engaged in it. They can see how the rules are going to impact the researchers in the labs. And so we do that to integrate the faculty. That helps buy-in overall. So those are some of the things we do. And then we also have, we try to engage the faculty in the laboratory inspections. And it's important that the faculty don't push off the inspections to, say, a grad student who's new to the lab, and so their role is to interface with the EH&S, but rather the faculty engage with the EH&S in the laboratory inspections and improvements and needs and requirements. So there's a lot of things that our EH&S does to try and interface with the faculty, to establish the personal connections, to establish that engagement. We have like one laboratory inspector from EH&S that has a multi-year relationship with faculty, and we think that helps overall.
Fantastic. Just on the same vein or a similar vein here, Mary, I was wondering what measures you're taking to more permanently solidify the general safety awareness that exists in our current COVID landscape.
Yeah, it's a good question. I think kind of as Craig said too, it really needs to be a personal initiative that people really feel is important for themselves. And I think what we learned a lot through COVID-19 too is things we do for ourselves are things we do for everyone around us. And what I would like to do is to make sure that we keep that message going, because that is the hallmark for all of our safety programs, is not just to keep myself safe, but to keep everybody in my laboratory area safe too. So I think trying to bring that type of energy to, like Craig said, our safety committees, our lessons learned. We have different ways where we do what we call like safety visits rather than inspections, where it's more of a conversation, right? Not just like looking at your fire extinguisher and saying, is that good or not? But really saying like, do you have challenges, or what do you find when you're doing this type of work? And really trying to find what things can actually really assist with the laboratory personnel, along with benefiting health and safety at the same time. So I think trying to incorporate some of those measures. And Matt, as you said, I think we've gained a lot of credibility in the last year of showing that we can and we know how to best protect people. And I think we need to keep building on that, and have those cross-functional teams is really essential. So not trying to go alone, but going together.
And I think that you said it perfectly there. We have built up as health and safety professionals a lot of credibility with people. And now is not the time to sit back on that. Now is the time to keep building on that and use that to really, that's how you get those roots down, and that's how you create a lasting safety culture. Is it's not by doing it once and then letting it degrade again. It's really riding that and continuing to turn that into a more developed, more deeply ingrained relationship. So before we move along to some more of our Q&A, and a huge thank you to everybody who is dropping in there to ask more questions. It's going to be, I think, a lot of great discussion going forwards. I'm going to go ahead and launch a poll here. So this is the Environmental Health and Safety Community Connection webinars. We rely very heavily on you, our health and safety community, to keep them going. That means that we need to know what panels or topics you're interested in. We need to help identify more panelists, like Mary and Craig, who donated their time again to come back on with us, even though, they are so busy with all the work that they're doing, helping to create the space where we can all talk about these topics and have this back and forth and share this information. So we are startlingly close to about a year on these, in just 2 months, we'll have our year-round mark. Craig, I think you were on our second panel ever. Is that it? Yeah. And it's just great to have these keep going, and they keep going because of your participation. So definitely, please go ahead and fill this out. If you know anybody who would be interested in being a panelist, I'd love to be able to meet them. And then in addition to that, just so that we don't bother everybody unnecessarily, if you're interested in participating in one of these drop-in problem-solving sessions, just a chance to come on, talk with Jonathan and myself a little more one-on-one. We'll be doing a series of 10-minute problem-solving sprints over the course of the hour to kind of help you solve the things that are on your mind. So I will leave that up for everybody to answer as we're going. And go ahead and take a quick look at our word cloud, see kind of what's on everybody's minds here. Looks like some things on controlled substances, risk perceptions, new Bumble, biosafety, soft skills, some pyrophorics here. So it's great to see the range, and this will definitely be helpful for me going forwards. All right, well, our first and top question here is from Maria. She'd like to know if you could please elaborate more on the new ventilation standards for lab space.
Sure. So I'm not sure for Craig, but for me, it's more to look at what does the ASHRAE standards recommend, and go through that. I know some people are also, when they're building new buildings, are looking not only at a LEED certification, but also well-being and a well-building certification, which also has recommendations to be able to acquire those certifications that do have some around the ventilation of buildings and the HVAC systems. There might also be others that maybe I'm just not aware of at this time.
Yeah, there's a lot of competing desires when it comes to building ventilation. So COVID-19 has shown us that we want to have a lot of air exchanges per hour in the building. And so in lab buildings, it's pretty good because we have the hoods, but in other buildings, that's an issue where COVID is making us change the standards. But then within laboratory buildings, then the hood efficiency, velocity, et cetera, is competing because on the one hand, for safety, we want to have high air exchange, air velocity, but the money cost of sucking all that air out of the room that's been heated or air conditioned is just such an incredible cost for the institution. We've seen I've seen the calculations that it's amazing how much a hood can cost the institution. So one of the things we did at UCLA was to try and have a program on shut your sash. So you can see my background it's actually a hood sash where people write chemical structures on it. And so the simple act of shutting the sash then can save on building costs because you're not sucking out all the air. And then it can also have advantages for the other hoods operating at peak efficiency. But getting researchers to always do that when they walk away from the hood is sort of a mixed success. And so you can think of a lot of different ways to try and incentivize that. And for students, one of the ways was pizza.
Oh yeah, the classic.
Food always works.
Literally greasing the palms, huh?
Yep.
On top of that, Maria, I'm not sure if you were on for our 2 previous ventilation webinars, but we had one on laboratory ventilation best practices and also one on resolving critical ventilation issues. In addition to just the content spoken about during those webinars, I believe one or both of them have some auxiliary research or resources from our panelists as well. So those might be of assistance for you as you try to, sort of navigate the answer to that question. Going up next, we have a question here from Carmen asking if there are any ideas related to shared office spaces or cubicle areas. Is this something that either of you have had to encounter or navigate yet?
We have the, I forget what we call it. There's actually a name, I guess, that we use and now for these office spaces that are all kind of, you have a neighborhood that you go to, but you don't necessarily have a guaranteed spot desk of yours. You have to find it every day. So that definitely has its challenges during a time like this. You can't really be doing sharing of offices very quickly. But what I would say is what we did is of course reduce the total number of people that could be in those types of spaces initially, taking a look at that, and then saying, okay, do we need to have additional barriers or not? Making sure we have distribution across the space, and just reducing the overall amount of people coming in at the same time by having schedules for rotation and for actually saying, okay, I'm going to come in the morning, you come in the afternoon. So those were some of the ways that we dealt with that. Luckily, most of our critical work wasn't with people that had to be in office cubicle spaces too much. So we just asked the researchers that if you have to come in, please come in, do the critical work that you're doing, typically in the laboratory space, and then do your other work at home if possible. So that helped not having a large amount of people in the open office space.
One of the problems that we identified with a sort of a shared or a WeWork type office environment was cleaning and sanitation. So if someone comes in for an entire day and uses a space and then leaves, then it's pretty much safe the next morning. But if you have people come in for a couple hours and then leave the space and someone else comes in, then what do you do in COVID times in terms of cleaning and sanitizing that space? So we didn't find that to be an immediate solution that we wanted to pursue.
Mm-hmm. One of the things we did for that, I kind of forgot until you mentioned this, is we actually have little tiny flags. So if you actually used your space, you put up your flag, and then people would go around every few hours to see what space was actually being utilized. So it's not perfect, but at least gave us an idea that, oh, someone was actually in their office today or in their cubicle space. And we knew, along with just the routine cleaning we were doing throughout the day, that we could hit those spots too and be aware.
Great. Moving on here, and a big thank you to Laurel for jumping onto that question and adding your perspective. We actually have a question here from Laurel asking, we are starting to get questions from researchers asking that if all members of a research group are vaccinated, can they work closely, less than 6 feet together, stop wearing masks, etc.? I know this answer may change over time, suggestions on how to address this. And one of the things that I wanted to call out from an earlier point in the conversation, Craig, you mentioned this recommendation from the CDC about not wearing masks, or people with vaccines not needing to wear masks indoors. I think there's an interesting psychological perspective there too, right? Of if you have people who aren't wearing masks, do other people know that? Do they trust that that person has been vaccinated, or is there a concern that maybe it's just some random person not wearing a mask? And having that psychological trust present just seems a challenging thing to try and tease apart. So are there any suggestions on how to kind of address some of these requests to start working closely as vaccinations rise?
Yeah, so are the specific recommendations that I'm actually like today working on writing up for UCLA is that the reduced restrictions would be within research space controlled by a group. So if there's a professor with 10 graduate students and postdocs and undergraduate researchers, then that little pod, we talk about a pod of immunity. So if everyone in that pod is vaccinated, then in their research space that they can control, then they can follow the CDC guidelines of not social distancing and not having mask use. But as soon as they leave that research group controlled space, if they go in the hallway, in the bathroom, in meeting rooms, around anywhere else across campus, then they're going to have to follow the general guidelines. So in terms of what you asked about the trust, then it's this close-knit type group where I think there is a lot more trust because everyone works with each other every day, and so that trust is built up.
Yeah, that's a great nuance to have there. Smart look forward. So yeah, are there any recommendations there outside of the pod ideas? Great. Mary, was there anything you wanted to add to that question before we move on?
I think we're just working off of a very conservative framework for our researchers, and we want to ensure that we're always ensuring a good level of inclusion for everyone, right? So I think we'll keep the additional controls in place for a fairly long time to ensure that everyone that needs to have access doing critical work can, and not really change the policies too quickly, just because I think it's going to be hard to do on a large scale anytime in the near future. But I think we're having the conversation, starting the conversations to see where it can be. But I think just to ensure that everyone can be in our laboratories when they need to, we'll keep those controls in place.
Yeah. And thinking about the time course of change, if we actually use vaccination status as the basis for some ramp up, what we're predicting on our site is that amongst those 850 laboratory research groups, there'll be a small number that will be fully vaccinated, say by next week. And it will probably take several months to have all 850 groups fully vaccinated. So as a consequence, if we start having ramp up based on vaccination status, we'll be able to monitor the outcome of that before it's the campus wide. So literally we'll have a couple groups, a couple dozen groups ramp up soon, and then each week dozens more. And if there's any occurrences of transmission of COVID or outbreaks, then we'll be able to recognize that, monitor that, and then change things rather quickly. So it's not going to be an all or nothing across the whole campus. It's going to take time.
Moving on here to David's question. David wanted to know, will you please share thoughts you have on potential health impacts associated with increased screen time required for virtual working? And what might we do to mitigate those risks? So I'm not sure if this falls into either of your wheelhouses. Absolutely want to open this up to our general community of people who are on to go ahead, post any resources that you found useful or any knowledge you have. This is one of the things I love about these webinars, is that it really relies on the knowledge of everybody here, not just the folks we have who are donating their time to be panelists.
Yeah, I would say there are some good resources on the American Industrial Hygiene Association website around VTC screens and other, and the risks involved with that. We haven't addressed the issue of the amount of screen time necessarily, but we are focusing a lot of our time on what training, resources, awareness do we provide to people that we know will be working in a remote way at a much higher percentage of time, probably continuing forever at this point. So we are definitely ramping up and making improvements to our kind of our work from home, and obviously looking at what people are doing and their tasks throughout the day is an important part of that and needs to be part of that risk assessment. So it's a good question.
Yeah, in addition to worrying about eyesight impact based on looking at the screen, for me, I worry more about people's posture and their chair they're in, and they're sitting in a chair all day long. I think the impact on their body is going to be probably equivalent in danger to the impact on their eyes.
Mm-hmm. And there are some nice tricks with screens where you can change the brightness and different things. So they do have some flexibility that people could utilize, and maybe making a tip sheet for people would be helpful too while we give training and awareness to people.
Yeah, and this is something that would probably fall more into the group who's going to be handling ergonomics, or whoever that specialist is, but having reminders to spend time looking away from your screen too. Having alarms or things to just say, hey, stare off into the distance and think about things without just burning your eyes out on the screen can be really helpful.
Yeah, definitely.
All right, well, we are a little bit past our 4 p.m. Eastern end time. Time has just blazed by here, and it's been a bunch of fantastic conversations. We still do have a lot of open questions in our Q&A. So this is the point where, we want to thank our panelists for joining us today and donating their time and energy to letting this discussion happen and creating this space. And if either of you are able to stick around for another, 10 minutes to answer a few more questions, we'd love to have you. But otherwise, a big thank you for joining us. Which will also still be extended if you do leave.
It's okay for a few more minutes.
I'm good too for a few more.
Great. So next question here is from Laurel, again, asking, sustainable design is a big concern. Our newest lab building has a predominance of open cubicle spaces and open labs. The open office areas have minimum air change rates of maybe 1 or 2, too much or much too low for COVID safety and for allowing usage by more than a couple of people. Any suggestions for having successful conversations with the sustainability people? So, Laurel, I'd love to hear more about this particular challenge. It sounds like maybe you've tried to have conversations with the sustainability people before and they just have maybe tuned you out or not really heard what you're trying to say. So any communication tips, or is this something that the two of you have encountered specifically?
Yeah, something that we definitely deal with a lot on our projects is how do we balance everything. So I guess I would say to have the conversation and to see what flexibility in your system do you have, because hopefully we won't have to necessarily have these controls in place all the time after maybe a year from now or so. But if you have a sized system that could allow you the flexibility that when we would need the increase, it could increase, but that you're not using that energy on a daily basis, that might be a way to just see. A lot of times they will size things a little bit larger than needed, and you might have some flexibility there, but not have to be the regular setting necessarily.
And also, retrofitting is always more expensive. And so when you do plan buildings from the start, if you can plan in a little bit more flexibility, a little more capability, it's always cheaper to do it at that phase rather than trying to retrofit into an existing building new air handling capabilities. One of the things we're looking at is filtering. And so in addition just to air changes, if you have filtering, if you're recycling any of your air, then that's important too. But the capability of doing that is so much easier to build in rather than to retrofit.
And if memory serves, we have had a lot of good conversations on this topic back during our Resolving Critical Ventilation Issues webinar. So definitely recommend going to take a look at that one as well. I think that there may be some useful information for you there. Our next question here is from Stephanie, asking, in your experience, how did the interactions between your EH&S units and occupational health change during COVID? Do you see these changes lasting? So Mary, is that one that kind of hits
that speaks to me. I feel like they're like our best friends. So I
love
that. They might be some of the first people we hug after COVID is done. But I would say they are just essential team members to work together. And I think although we always work together on our medical surveillance programs, they were on our institutional biosafety committees with us and other things. It's really really great to have people that are also looking at the CDC recommendations and all these different things that are coming at us very quickly, and knowing their perspective, learning their perspectives, and helping us navigate this. And I think they really helped us be able to have good, sound principles and guidance for our company at a time like this. So they were invaluable, I would say.
All right, great. Let's move on to our next one. Yeah, it's always great to hear that there's that cross-team connection there. I mean, it's so funny how often safety gets siloed because it's something that addresses issues that can sometimes be a little bit ephemeral or hard to grasp, that have definitely become much more concrete during COVID. In reality, successful safety is successful operations, and seeing those connections be formed during COVID is really great. And getting back to Mary, what you mentioned earlier, let's build those relationships and continue those building those relationships as we go forwards. Next question here is from Mary Beth. She'd like to know, another topic is facility utilization. These practices, or the practices to limit interactions, can now be used to change how we utilize spaces. So I'm not quite sure how to parse that one personally. Mary, would you mind maybe rephrasing that? Did that resonate with either of you?
I was thinking maybe that has to do with how we look at organizational design or leadership. Because I think what we're going to find is we're not going to ask people necessarily to be in the office 9 to 5 anymore. Right? I'm thinking we're going to look at our organizations and say, when are the most pertinent times that are really valuable for us to get together? Kind of like Craig was saying, when we can have a forum, get to really like weed out ideas and stuff, yeah, we want to be face to face. We want to be able to be in that environment. But do you have to be in that environment 4 days a week or 5 days a week constantly? Maybe not going forward. So I do think there's a great opportunity now to look at our policies and see really how we're organizing our teams and making that balance in you know, work life and things like that, that can maybe be helpful for people.
It's interesting from an academic perspective, because you can go back, you know, thousands of years to the Greeks, and the image of the Greek philosopher with a crowd of students around them, and the philosophers pontificating about the meaning of life. And then you go forward a couple thousand years to today, and universities are still sort of the same, right? So professors, when they teach classes, we're surrounded by groups of students, and there's a desire to get back to that modality. Zoom hasn't always been perfect. Some students have actually thrived just fine on Zoom, but there's other students who don't learn as well in Zoom. And so I think one of the things that universities need to worry about is having different modalities for instruction and accommodating different learning styles. And so we are looking forward to getting back and having more one-on-one interactions with students and faculty.
Yeah, I wonder a little bit if there is going to be a little bit of a renaissance after this, right? The energy that we're going to get from being in a room with new people, once that becomes a safe thing to do, that's going to be a little bit intoxicating for a while, I think.
Yeah.
Definitely.
Going on to our next question here from Roma, asking, how are you identifying your vaccinated versus non-vaccinated groups? So is that something that either of you are tracking or are involved with tracking?
We're looking at a couple different ways of doing it. So I was vaccinated yesterday, so I actually received a card, so I can show a card that I was vaccinated yesterday. But we also have required symptom monitoring. So anyone wanting to go to campus any day, they have to, before they arrive, fill out a symptom monitoring survey that asks them about whether they've had any symptoms or temperature, or they've have any exposures. And so we're probably going to add in a question, you know, have you been vaccinated? And then there's questions related to, you know, HIPAA related questions, like, can you ask that question? But then even beyond whether you can ask the question, how do you use the information? And how do you store the information? So if your institution is thinking about even asking the question, are you vaccinated? You have to think about how you're asking it, who's asking it, then how you're using the information, and how you're storing the information. And so you need to meet with legal counsel to try and cover those things.
Yeah, I think right now we're not looking to really gather the data. We're really just focusing on promoting vaccinations, getting the word out and awareness, trying to put in place policies where people can have access when they need to. So if they need to take time off as a critical worker or things like that, making that available, we find is really important. People really want to have that flexibility to be able to do that. So right now we're not necessarily gathering the information because we're still trying to figure out exactly how or if we want to do that. But we are just heavily promoting that people get the vaccination.
Right. And the UCLA community, if you add up all the faculty, staff, researchers, and students, we actually are a small city of about 70,000 people. So just on our one site, right, the UCLA. So we have fairly regular messaging from our health professionals in the form of webinars on vaccinations. So we're trying to educate the university community about, you know, what are the vaccines, what are they about, how can you get them, what are the advantages, what are the potential health risks, who should be doing it, what are the outcomes, what studies have been done, because we know, for example, that the studies have not been done on youth for vaccinations. So we have regular educational series to try and educate our campus community about vaccinations.
All right. Well, we are at time here. That was just a blaze of information. Some really great conversations. I know I had a lot of fun listening to both of you talk about the things that we're on your minds that you were looking forward to and thinking about. And apologies for the siren noises in the background here. I'm going to mute for a second.
Yeah, and my apologies for my phone. I think my plumber has been trying to say that he wants to get to my house.
That's part of the joys of working from home, right? We're just, I think, a lot more accepting of the sort of human realities of everything. You know, my internet was down at the beginning of this. Fortunately, no blips since then. But I feel like in some ways, you know, a lot more connected to the people that I work with, just because of how much more understanding there is about, you know, the difficulties in our lives. So
Yeah.
a huge thank you. Oh, sorry, Mary, you were going to say?
Oh, no, just agreeing with you that definitely you get to see more sides of people.
Yeah. Yeah, especially the pets.
Yeah.
Well, a huge thank you to both of you for joining us today, for donating all of your time and energy, for creating, again, this space where we could talk about these issues and explore them together. Huge thank you to everybody who joined our Q&A and was so engaged and asked all those questions. And I look forward to seeing some of you next week for our drop-in problem-solving session. You can register for those on any of our EHS webinar pages. Just go down, click the button with the person holding the dandelion. Hopefully, you know, myself and Jonathan Klein will be able to help you. And if not, we will be holding those every other Thursday in between our webinar weeks. And next up, we've got for webinars, designing safety training that sticks. Got a great little word cloud of upcoming topics that I will definitely be mining for information. And I will see you all soon. So have a fantastic weekend and stay safe out there.
Thank you, Matt.
Thank you very much.
Great. Bye, everybody.
Bye.